This is the Emergency Medical Response section of the Fire District's Recruit Training Program. It's very important that we be able to handle ourselves on emergency medical responses because at least 3 out of 4 times that we're dispatched to a call, there is an emergency medical related issue. And so how do we help you? How do we help you get ready? How do we train you? Well, the first thing we're going to do is the Emergency Medical Responder, the EMR course. We're going to do that first, and we're going to do it fast. We're going to do it in 5 sessions. We're going to cover a lot of things in terms of a broad range of cases and types of problems, emergency medical problems, but we're not going to go real deep. We're going to get you to where you can do what Mrs. Smith needs you to do, and then we'll move on from that. Then we're going to finish your program with EMT. So the EMR part builds into the EMT part. EMT is the goal for new fire district members. Once you're an EMT, you've met the requirement that we have. Then we have some other courses for you if you want to go deeper. We have an advanced emergency medical technician, the AEMT course, and we have the paramedic course. And we'll be happy to help you learn more about those, and we hope you join in on those. But we need you to be an EMT. Mrs. Smith needs you to be an EMT, actually, and here's what Mrs. Smith needs you to do for her when she calls 911 and there's an emergency medical response that occurs. She needs you to find things and fix them that might harm her, no matter what that may be, and we'll talk a lot about that here in just a bit. She also needs you to work with the paramedic ambulance service. She didn't call 911 so that a fire truck with a couple of EMRs show up. She called 911 to get an ambulance. She called 911 to get paramedics. They come on the ambulance. And so we need to do things to work with the paramedic ambulance. Mrs. Smith is our customer until the ambulance gets there, and then we have another customer, and we really need to focus on helping the paramedic crew with whatever it is that they need. Mrs. Smith also needs us to explain some things to her. She probably doesn't call 911 for an ambulance every day. This may be the only time she ever has. And so she and her family need us to help them get through this. This is a bad day for them. And so we need to do whatever we can to help. What does she expect from us when she calls? Well, she expects us to be there quickly. She expects us to do things safely and not involve other people in the response that aren't already. And she needs us to be nice, and she really needs us to be good. What kind of things happen to the Smiths? Well, sometimes the Smiths die, or they go into cardiac arrest, which might be reversible. Sometimes they suffer things that cause them to be in shock. They suffer things that cause them to have hypoxia, which we'll explain more. They have various injuries that occur, and sometimes some new Smiths are birthed. And so the idea is that we're going to prepare you in the EMR section to handle all the things that happen to the Smiths, as well as those things that we can do to help them in the ambulance. Our plan is to respond promptly and quickly, approach the scene and enter promptly, efficiently, and safely, to be nice, be good, and be safe always, and to help that paramedic crew help the Smiths. Here's how we're going to help you get to where you can do that for Mrs. Smith. We're going to help you with some valid training that is well thought through, taught by experienced folks, and that has served well over the years. Training that's efficient. We will not waste your time. You're volunteers, and the worst thing we could do is waste your time. So there's not as much a requirement for hours as a requirement for competency. We are going to do things very efficiently, and when you've got it, you've got it. And until you get it, we're going to keep working with you. We're going to train on things that are realistic. One of the things that we use throughout our EMS education programs is simulation. And we know that that works. It's not just something cool and fun. We use it because it is effective. And so we're going to work with you in lots of settings like that. And overall, we're going to bring some coaches in. They're going to coach lots and lots of really good reps on all this stuff that we do. There's a series of tools that you will need. Some of those are trucks and maps and radios and policies and protocols and things like that. There's a bag of equipment, an EMS pack, and some other equipment, and you'll be very familiar with that before EMR is over. We're going to give you an assessment and treatment plan, and we haven't done this before. We've kind of taught assessment out of the book, and and we've taught ways that work, but we have a way that we're going to go. And we're very excited about giving you this tool and helping you learn to use it. We're going to teach you to use the EMS notes form and also to give a handoff to the paramedic crew. Your exposure to the patient by yourself before the paramedics arrive can be anywhere from a minute to 20 minutes. And so we want you to be able to help the paramedic crew integrate into the call and have them be able to start where you are as opposed to starting from scratch. The getting there part, you've done some of that with evolutions in the recruit class before this first session of EMR. You've worked on the response and arrival sequences, had some work with maps, radios, and vehicles. We will continue that. We are integrated in with the rest of the recruit program, and so we're going to build on what you've learned and give you more reps with maps and radio traffic and that sort of stuff. We have training EMS packs that are just like real packs. You're going to be so familiar with that red pack before it's over that you're going to know where everything is located. We have things that are organized in a logical way to give you quick access, and we're going to have lots and lots of reps on using those. Here's the assessment and treatment tool that we're going to give you, and it's just 5 steps, and you'll find that we have a lot of lists of 5, and tell me 5 things about this, and 5 steps for that. Well, our assessment and treatment tool has 5 steps. And the first thing is this a cardiac arrest? Everybody calls it a code. Is this a cardiac arrest? Are we going to be doing CPR using the AED? Is this a code? If that patient is talking to you when you walk in, you can go through that first step pretty quick. Then we're going to check on their circulation, ventilation, and oxygenation, because our patients need to circulate, ventilate, and oxygenate. And that's the very next step. Then we're going to do a real rapid exam where we're going to find everything and fix what we can. We're going to record some vital signs, and we're going to record some history. That's our 5 steps. So you might as well start learning this now. You might as well write this on your arm and don't wash it off. This is important stuff. The handoff, where we transfer care to the paramedic crew, real simple. What happened, what we found, and what we've gotten done before they arrived. And so we want to practice that, and I think that's something that we'll start to get better at as an organization, and we're going to start it for certain with your recruit program. In your EMR class, we're going to run through 5 core cases. We're going to work cardiac arrests. We're going to work patients who have lost blood volume due to various injuries that have happened to them and are in shock. We're going to deal with patients who are low on oxygen or hypoxic. We're going to deal with patients with multiple systems, body systems involved in a trauma. So an extrication, a vehicle ejection, a fall, those sorts of things. And we're going to birth some babies and take care of those babies. It's going to be fun. EMR is first in your program. It's fast. In 5 sessions, we're going to get you where you need to be, and we're going to evaluate you along the way. And then that 5th session is a big evaluation where we give you some real strong feedback, and we can make some course corrections or changes in the plan at that point. So welcome to EMR, and buckle up. Here we go.